right, in this video we're going to talk about modifiers 54, 55, and 56. When a surgical procedure is performed, normally you have what's considered to be a global procedure. And that means that the doctor is being paid for doing the surgery, plus the post-op follow-up, and if there was any pre-op evaluation, it is all bundled into one payment for the procedure. So on your screen, we have the mastectomy. So the doctor gets paid for all of it. So the doctor would bill the code and get paid for all of it in one chunk of money. Well, what if the doctor didn't do the whole thing? I always use the example when I'm teaching of you need your appendix out. Okay, you need your appendix out. You go to the emergency room, they say it's your appendix, okay, take it out. But here's the problem. You were on vacation in Florida. You went to Disney or Universal Studios or whatever your preference is. And you ended up in the emergency room there. So when you got the appendix out, you need follow-up care. We need to make sure everything's healing correctly. But you're not staying in Florida. You're getting on the plane and coming back home. So the surgery was done by doctor number 1, but your post-op is being done by doctor number 2 back home. And guess what? With your appendix, there was no pre-op evaluation because you didn't know ahead of time that your appendix was about to burst. So there was no pre-op care, and that's common in emergency situations. That's very, very common. So both doctors are going to bill the appendix removal with the correct modifier that tells the insurance company which part of the service they deserve to be paid for. So the one doctor is going to put a 54 on there. I am the surgeon. I did the cutting. Pay me for the procedure. And then doctor number 2 is going to put a 55 on there saying, pay me only for the post-op care. I did not do the procedure, but I'm doing the follow-up care. And this allows the insurance company to split the payment between 2 doctors that shared the responsibility for this patient for this procedure.